This is an interesting case, or at least I think it's interesting. But this is a quick hit case here. So clearly there's septal thickening. This is a baseline study. But as we're looking at the septal thickening, it looks like edema, not much pleural effusion. I think it's important to remember this is a younger patient. So this patient is 47 years old, so relatively young. Older you get, the more that age seems young. So that's about my age now. But in addition to the septal thickening, we also see these nodules. For example, these sort of interesting nodules here. Some of them are septal if you actually look carefully, or some of them are sort of like at the corners of septa. And so already we're thinking these are engorged lymph nodes. But some of these look like they could just be maybe not even in the septum, in this associate with the septum, but maybe not directly adjacent to a septum. So the question is like, well, what's going on here? With diuresis, what happens? Well, I'll show you. Septal thickening goes away, and all those little nodules also go away. They just melted away. I guarantee you they've gone away. If you don't believe me, here's the vessel subtraction, same day. And so obviously if we're going to see if there are going to be any nodules, even interlobular parenchymal, pulmonary parenchymal lymph nodes. We're going to see them on this vessel subtracted image. There are some scattered granulomas within the right lung, but no evidence of lymphadenopathy. Let's go back to the original CT, the baseline CT. And so if we look carefully again, see these nodular foci, many of them associated with interlobular septa. So these likely represent enlarged lymph nodes, or these could represent venous lakes. So areas of pulmonary venous ectasia along interlobular septa, which are engorged in the setting of pulmonary edema. Another pearl here, this was taught to me by Dr. Heber McMahon, who used to work at University of Chicago. He's one of the giants of chest radiology, who wrote the original Fleischner guidelines, did a ton of research with 200G subtracted chest radiography. I miss him, miss working with him. He was great, a great dry sense of humor as well. But he would talk about how only in the setting of young patients do you really get pulmonary edema without pleural effusion. So older patients, when they get pulmonary edema, almost always you'll have concomitant pleural effusions, especially on chest CT where our sensitivity is so high for it. But in younger patients, and again, 47, someone may make the argument, I'm 47, that 47 isn't that young, but I think this is young enough. So when you start pushing into like mid 50s, upper 60s, almost by a rule, if you have pulmonary edema, you're going to have some degree of pleural effusion. And the way I sort of reason this out is that younger patients, we have better interstitial clearance, lymphatic clearance, and therefore it's easier to clear out that fluid which it normally would have collected within the pleural space. Anyhow, hope you like that case. Have a good day.